Today, we're going to unravel a feeling that a lot of us know, but very few really understand: nerve pain. We're going to go from a super common, everyday sensation all the way to the absolute cutting edge of treatment. And it all starts with a feeling you might just recognize.
You know the feeling, right? That pins and needles sensation, maybe some numbness in your fingers that wakes you up in the middle of the night. You shake out your hand, it seems to go away, but then it's back. So is that just some random annoyance, or is your body trying to send you a very specific message?
Well, for a lot of people, that tingling is the first sign of something called carpal tunnel syndrome. And these ultrasound images, they show us exactly what's happening. The arrows are pointing right at the median nerve, and you can see how it's getting squeezed and swollen as it tries to pass through this tiny little tunnel in your wrist. It's basically a traffic jam for your nerve signals.
To give it its proper name, carpal tunnel is the most common kind of entrapment neuropathy. Now that sounds complicated, but it's really just a fancy way of saying a nerve is getting trapped or squeezed. In this case, it's the median nerve, and all that pressure is what's causing those weird tingling, burning, or numb signals that are shooting up to your brain.
So let's stick with that annoying tingle for a minute, because if we can understand this one specific example, it really opens up a much bigger story about how our nervous system works and what happens when things start to go wrong.
The key thing to get here is that this feeling isn't vague or random at all. Nope, it's a direct distress call from one single nerve, the median nerve. Every single symptom, from the tingling in your thumb and index finger to maybe feeling like your grip is weaker, it can all be traced right back to this one little point of pressure.
So how does this one example fit into the bigger picture? Well, it turns out this pattern of a single squish nerve causing all sorts of problems, it's not unique to the wrist, not by a long shot. It happens all over the body.
And this brings us to a bigger medical term, mononeuropathy. Let's break it down. Mono means one, neuro means nerve, and pathy means disease. So it's a condition where just one single peripheral nerve is causing all the trouble, usually because it's being pinched or squeezed somewhere along its path. And you can see this pattern everywhere. You squeeze the median nerve at the wrist, you get carpal tunnel. You compress the radial nerve in the arm, you can end up with something called wrist drop. You pinch the ulnar nerve at your elbow, the funny bone nerve, that's cubital tunnel syndrome. And down in your leg, if you put pressure on the peroneal nerve, it can lead to foot drop. One nerve, one point of pressure, a whole lot of problems.
Okay, so if all these conditions are just caused by simple physical pressure, why is the pain so weird? Why the burning, the feeling of electricity, the tingling? This is where we get to the absolute heart of why nerve pain is so fundamentally different from any other kind of pain you've ever felt.
It turns out that these mononeuropathies and a bunch of other conditions that damage the nervous system, they all cause something called neuropathic pain. And trust me, this is not the kind of pain you feel when you stub your toe. It's a whole different ballgame.
The official definition says it's pain that's caused by a lesion or disease of the nervous system itself. Here's the most important part. Regular pain is useful, right? It's a warning signal. It tells you, hey, take your hand off that hot stove. Neuropathic pain has completely lost that purpose. It's not a warning system anymore. It's a malfunctioning system.
This diagram shows us exactly how that malfunction happens. Now, I know it looks complicated, but we can really break it down into two key ideas that explain pretty much everything about why neuropathic pain feels so bizarre.
First, I want you to think of your nerves as electrical wiring. When a nerve gets damaged or squeezed, that wiring gets frayed. And what happens with frayed wires? They can start to short circuit, firing off pain signals all by themselves, with absolutely no reason. That's called ectopic activity, and it's why people feel those spontaneous burning or electric shock sensations. The nerve is just firing off randomly.
Second, something happens called central sensitization. This is going on in your spinal cord. It's like the central fire alarm for your whole body becomes way too sensitive. It starts treating every tiny little signal, even a light touch, as a massive 5-alarm emergency. It literally amplifies the pain signals, turning what should be a whisper into a deafening scream.
And when you put those two things together, the faulty wiring and the oversensitive alarm, all those strange symptoms suddenly make perfect sense. That spontaneous burning pain, that's the ectopic activity. Hyperalgesia, where a small painful thing feels way worse than it should, that's the central alarm amplifying it. And allodynia, where something like a bedsheet brushing against your skin feels excruciating, that is the ultimate example of central sensitization.
So, now that we kind of get the problem, how in the world do you treat a system that's so fundamentally miswired? You can't just throw a standard painkiller at it. Instead, doctors use a very structured, multi-layered approach to try and calm the whole system down. It's usually broken into 3 tiers.
This is the basic roadmap for treatment. It's a tiered system. You start with the options that are the most proven and have the best safety profile. And you only move up to the next step if the first one doesn't bring enough relief. It's a really logical progression.
So let's take a quick tour of the toolkit doctors have at their disposal as they move through these tiers.
The first line of defense is all about medications that directly target that malfunctioning system we just talked about. So you have things called gabapentinoids, which basically work to calm down that faulty wiring and make the nerves less likely to fire randomly. Then you have certain types of antidepressants, not because you're depressed, but because they work on the brain's own pain-dampening pathways, helping to turn down the volume on that oversensitive alarm.
Now, if those first-line meds aren't quite cutting it, the toolkit gets bigger. For pain that's in one specific spot, a doctor might try a topical agent, like a lidocaine patch, to numb the nerve endings right at the source. For problems that are more widespread, they might use something like a TENS unit, which uses a mild electrical current to essentially scramble or disrupt those faulty pain signals before they can even get to the brain.
And finally, for the most difficult, most persistent cases, you have the third-line options. These are highly specialized treatments, things like ketamine infusions or medical cannabinoids that target very specific pain receptors in the brain. They're really reserved for these tough situations because, while they can work wonders, the evidence is still growing and the risk of side effects can be a bit higher.
So what does this whole toolkit really tell us? Well, it paints a picture of a really complex problem that needs a sophisticated and, importantly, a personalized approach. It's not about finding one magic bullet. It's about understanding the person and their specific pain to choose the right tools for the job.
And why does this matter so much? Because this is not some rare condition. Research shows that somewhere between roughly 7 and 10% of the entire population suffers from some form of neuropathic pain. That's a staggering number of people, possibly 1 in 10, living with these incredibly difficult symptoms every single day.
And this brings us to what might be the single most important takeaway from all the research. There is no single answer. The best, most effective approach is a multidisciplinary one, combining the right medications with things like physical therapy, psychological support, and even lifestyle changes. It's about treating the whole person, not just the faulty nerve.
And this all leaves us with a final, really hopeful question. Our understanding is shifting away from just masking pain to actually retuning the nervous system itself. As we get better and better at targeting the very source of these faulty signals, you have to wonder, are we on the verge of a future where we can finally, truly silence chronic pain for good?